Good afternoon, everybody, and welcome to Nottingham City ICP Share and Learn session. Hopefully most people know me, but I'm Hugh Porter, GP, but also a clinical lead and interim lead for the ICP. As you know, Tracy Tyrrell normally does his sessions, but Tracy was otherwise engaged today, so she kindly asked me to sort of step into the breach and host this session. And I'm really delighted to welcome Carla Capstick today from Small Steps, Big Changes, or as many of you will know it, SSBC. These Share and Learn events are sort of brief vignettes where we get to learn a little bit more about the partners, and I think many of you will have at least heard the acronym SSBC, but this is a chance to understand both what SSBC is doing, but equally I think Carla will touch on this, as importantly of how it's doing it. And some really interesting sort of stuff here to understand this lottery funded program that's been running in the city and is a core and key partner to the ICP. So I don't want to steal any of Carla's sort of thunder, so without further ado, can I hand over to you, Carla? So Carla's going to talk for about 20 minutes, take us through a little bit about what SSBC is, what they're doing, how they're doing it, and there'll be about 10 minutes at the end just for a couple of questions, but obviously this session is recorded and will be available to view later, and we'll pick up any questions we don't manage to answer. So Carla, over to you.
Thank you, Hugh. So thanks for the invite as well. Really pleased to be here today to talk a little bit about SSBC and to share with colleagues across the ICP and wider the work that we're doing. So if you just want to move on to the next slide for me, please, Mars, that'd be great. So for those that don't know what SSBC is, I'll do a real quick whistle stop, and these slides will be available after today as well for anyone who wants them. So SSBC, as Hugh's touched on, is a £45 million programme funded by the National Lottery Community Fund. We're one of 5 sites nationally. The other 4 sites are in Bradford, Blackpool, Lambeth and Southend. And we're actually a 10-year programme that's very much working in partnership with City Care as the accountable body for the programme and host for the funding and the team, the City Council, the voluntary and community sector and the CCG. And we have 4 years left. We'll officially complete the programme in 2025. And basically we are a commissioner of services and also approaches. So we're trying new ways of working, new ways of doing things. And we have some key principles around co-production, so working with the families and the communities that we support, about using evidence and science-based in our approaches, being very much place-based and also having a real strong ethos around test and learn. So trying things on a smaller scale, seeing if they work, doing rapid improvements around them if needed, and then looking at how we might scale them up across a wider area, whether that be across the city or across the ICS or across national, looking to influence national policy. This is a bit about our kind of vision and our principles. You'll very much see that we put children at the heart, parents leading the way, and then supported and guided by the experts. So that's just our real core principle that we hold true to. So next slide, please, Mars. So touching on that test and learn that I've mentioned as a core principle, SSBC only operates currently in 4 areas of the city, and those are highlighted there: Aspley, Bulwell, Hyson Green and Arboretum and St Anne's. And that's because, as I said, we want to very much look at what can SSBC provide that's additional to the offer in those areas already provided by services for, you know, whether that's maternal services, health visiting, council service, voluntary sector. And we work in those 4 wards because they have a high level of births every year. So there are just under 1,000 babies currently born across those 4 wards, because we very much focus on pregnancy through to a child's 4th birthday. They are also, as I'm most of you would recognise, levels of areas where there are levels of high need. So child outcomes in those 4 wards are not as high as we would like them to be, and there's certainly work that could be done in those areas to bring them in line with other areas in the city and to certainly improve in terms of kind of comparisons with national averages. They're also quite diverse, so obviously Aspley and Bulwell on the outer edge, and then the 2 more inner city areas provide us with an opportunity to test and learn whether things that work in one community, will they work in another community, and or do we need to take slightly different approaches. So next slide, please, Mars. So in terms of what we're trying to achieve in SSBC, we're very much focused on child development outcomes. So we're very much taking a long-term view as to what can we do differently in addition to the core services that I've mentioned, or through different approaches that will improve child's diet and nutrition, will support their speech and language and their communication skills, and also support positive and social emotional development as well. So those are the 3 key child development outcomes we focus on. Our 4th one is around cross-partnership system change. And locally, that's been defined as focusing on workforce. So what can we do to support our workforce to think differently, to work differently, to try new approaches, and to really focus on early child development and understand that and how important it is and the impact it has later on in life, that notion of 1001 days and the real solid foundations that provides for a child. Our second kind of system change element I'm going to touch on a little bit more, and then in the next slide is around co-production. So how do we work with our communities? How do we work with the parents of the children that we're supporting, and the fathers, the mothers, the grandparents, those communities, to really help and support them? And how do we ensure that their voice is at the heart of everything that we do? And then the final bit around system change for us is around how do we start to think about influencing local commissioners, potentially nationally, to really focus on prevention and that first 1001 days and make a really strong case for the investment in early years. And that's obviously part of the National Lottery's guiding kind of ambition, is that together the 5 sites will create a really compelling case to potentially influence policy at a national level. So if you want to skip to the next slide for me, Mars. So our parent champions, they are our real commitment to co-production. And for any of you that have had the pleasure of meeting one of our parent champions or our parent ambassadors, we have kind of a 2-tiered approach so that people can enter and get used to SSBC and its way of working. And then when they feel more confident and ready, they can step up into that parent champion role. They're truly inspirational. They really do represent and are the voices of their communities. I always think of them as almost being the voice and the pulse of the 4 communities that they represent. They really understand what it's like to have raised a child in those wards, to have been a parent, and they come from very diverse backgrounds. Some of them are working parents, some of them aren't working. They've all had different experiences themselves as children and through their own family. And they kindly share their knowledge and their lived experience with the programme, which really helps us shape how we think about our delivery of services, how that influences our commissioning. They have 40% of the vote at our board. They are very active board members. They also chair several other groups, and they're starting to get involved in wider things such as the Children and Young People's Partnership Board, the Strategic System Change Board. They've started to get involved with CityCare through their patient engagement group, and they're really keen to work with other partners as well. So if you're looking for a parent of an under 4 to give you some thoughts and views on your services, and they very much want to get them involved right from the start though. So they're involved in all our interview, and they're a key element to kind of our sustainability and how we work with other parents. And they influence things like our marketing and comms messages, making sure that they'll land well with communities, how readable and understandable they are. So they are a fantastic asset, and we're extremely proud of what they've achieved. And what they continue to do, and their ambition to kind of to carry on after SSBC and be a true part of our legacy. So next slide, please, Mars. The partnership, so you'll see we've got a really diverse partnership across SSBC. We're not actually an organisation, we are a partnership, and it's a collaboration of the sort of some of the partners that are highlighted there on the screen. Some of them are delivering services for us, so there are delivery partners. Others are linked to research and learning, others are around marketing and comms, and others are around that community and parent voice. So we've got a real diversity of people that we're working with, and as I said, some of those are our core partners as defined by the lottery, and then others are the people that we're working with or organisations that we're working with now as we move forward. And that's constantly growing, and I think it's important for SSBC that we continue to grow and develop our partnerships, and obviously a recently relatively new addition to that has been the ICP. So moving on to the next one, Mars. So this is a little bit about how we're working quite differently in SSBC. So I've talked about the fact that we work with our existing workforce, so that would be midwifery, 0 to 19, health visiting, as it sort of says on this slide, family nurse partnership, children's centre staff or early years, early help workers, the voluntary sector, etc. And we're working with those to kind of look at what else can we do to build on our governance. So it supports our governance, they're all involved in that, but also what else can we do that's additional to the services that they already provide. So we've got various projects in place with the City Council, with City Care, with the Healthcare Trust, and we've got one hopefully coming on board with NUH quite soon to say you already deliver this, but if you were to try a new approach and or you wanted to do more, or you wanted to try a different way of working, that's where they will come to SSBC, and we'll work with existing workforce to develop and come up with new ways things to test and learn that we want to try in those 4 communities, very much guided by the parents as well. In the middle one, the orange box, and apologies that the writing's probably a little small for people to see, we've commissioned a very different kind of workforce in SSBC, and this came from that genuine co-production with parents. They said they wanted to see a very different kind of workforce that was had lived experience of raising children, potentially lived or knew or worked in the 4 wards, so they understood what it was like to raise a child in Aspley, Bulwell, St Anne's, Hyson Green, Arboretum. And could work with them. So somebody who would work alongside them and very much embody the values of working with rather than doing to. So we commissioned a service called the Family Mentors. They are kind of the flagship for SSBC. So anyone who knows the programme will have probably heard of the Family Mentors. That Family Mentor service is currently delivered by Framework, Homestart and the Toy Library. So there are 3 delivery partners. And they have been working now for 5+ years in the wards delivering the Family Mentor service. And they deliver a manualised handbook called Small Steps at Home, which is based on evidence and learning from NICE, from the Family Nurse Partnership, from various other evidence-based programmes. We've developed our own handbook that they deliver, which cover all 3 of the key child development outcomes, as well as focusing on building parent capacity as the sort of the parent's first teacher and first supporter. And then finally, that blue box at the end is about other things that we've commissioned, which I've touched on a little bit around the kind of partnerships that we've got. So a core part of what SSBC does is obviously the services that we provide and that additionality around that commissioning level, but also there's key expectations around developing a really strong and robust learning and evidence and evaluation of what we do here in Nottingham and how that might then be shared, as I said, certainly locally to support decision making and commissioning, but also potentially at a national level when we come together with those other 4 sites. So we do bring in experts from outside the city as well, particularly around things like systems change, systems thinking, experts on early years, and then obviously people who work with us to really focus in on our understanding around community voice. How do we deliver that? How do we make sure that we've got someone who's supporting those parents to be independent of the programme and independent of all the other organisations that we're working with, but have the ability and the courage and the strength to really share their views in a meaningful way that are listened to and genuinely heard. So we've got a whole range of kind of other outputs that we have to produce alongside the services, and that's what some of that other commissioning is about. We very much focus on kind of how we collaborate when we commission as well. So we work very much in partnership with our approved providers to think differently about how we negotiate. So almost 50% of our contracts are usually nailed on. The other 50% get worked through as we're kind of working together to really think about, once those services are in place, often delivered by local providers, how do we build on their expertise and knowledge to get the best from the service and make sure that it lands with families in a way and addresses the needs that are pertinent to them. So if you just want to move on to the next one for me, I just thought I would share with you kind of some of our data and numbers, sort of our early signs of impact and outcomes, and certainly our outputs. So as I mentioned, we're just going into year 6 of the programme. We've got 4 years left to run, officially finishing in 2025. So far we are a from birth model. So we started working with newborn babies back in 2015. And so far we've worked with coming up to 5,000 individual children in that time. And there are 63 new family mentors in the city now, which is great in terms of new jobs that have been created through the programme, paying the living wage and ultimately building community capacity in those wards as well. As I said, the people are employed based on their qualities rather than their qualifications. They have to have had experience of raising children in one of those wards or be a grandparent. And they're very much then provided with a whole range of training which supports them to do their role as they work alongside families. So lots of kind of additional added benefits to SSBC and the funding that's come into the city in terms of employment and community capacity building, etc. So far, we've reached about 75% of the under 4 population in our wards. Now, that might not be because we've got a whole range and kind of spectrum of services we offer. It might be just one intervention that a family's had or an additional support package. It might be 3, 4, 5. And certainly in the next few years, we're going to be doing a little bit more work to understand the depth and breadth of different services that families have received and therefore the impact that has on outcomes. So, you know, what's the optimum number or the type of services that they have to receive alongside that core to really start to see an impact on outcomes. So if you want to move to the next one, Mars, that'd be great. Thank you. I think what I've touched on here is probably the ones that would be particularly of interest to the ICP partners. So some of our services that have got a real kind of public health and health focus and or a community capacity building focus. So we have a parent obsession group. Again, this came from the parents' really strong voice that they wanted to focus on oral health. So they've been doing some work on that. We've been doing quite a lot of work with the City Council, Public Health on smoking cessation and the Love Bump campaign. We also had a breastfeeding awareness campaign last summer where we worked with City Care, NUH and again Public Health colleagues focusing on that. And we've been doing a lot of work to promote the Healthy Start voucher scheme in the city as well, because sadly we've only got 66% uptake across the whole city, and we know that that's much lower in some of our BAME communities. So a lot of work to promote that. So next slide, please, Mars. So in terms of ICP and SSBC and how we kind of complement each other, I'm really proud that we're working alongside the ICP. And I've touched on the priorities that we've been supporting with so far, which is the smoking cessation workstream, the flu uptake and increase, and our programme manager is supporting with the health inequalities workstream. SSBC is also a member of the Change Nottingham Collaborative that's looking at kind of systems thinking, which is supporting some of that integrated care culture. And then we're doing a specific piece of work in PCN 6, looking at BAME community engagement with health services there. And I've touched on the SSBC approach throughout, but I think how we kind of match in with the ICP is, for me, I feel quite well in terms of we're focused on prevention, early intervention, public health approach, strong principles to co-produce, that collaborative commissioning, and very much focused on place as well. So the next slide, please, Mars. So in terms of so what, we've had this funding, as I said, we're into year 6. What are we learning? What are we starting to pick up? And a few people might say, you've had the money for a while now, why aren't we starting to see some significant impact and outcomes? It is still early days for us. The whole point of it being a 10-year investment was so that we could really look at that longer term investment and start to check if we allowed things to run for long enough, would we start to see the impact? Because we're a from birth model as well, the first SSBC babies that received services back in 2015 have only just started school. And in fact, some of them won't actually enter, well, we'll be getting their results from school this year. And obviously COVID's had an impact in terms of some of the school results. But we have commissioned Nottingham Trent University to work with us. They've completed 4 evaluation reports to date. That contract runs through till May 2023. And they've been looking at things like our baby massage offer, our cook and play offer, and the small steps at home programme that the family mentors deliver. And there's some really positive qualitative and quantitative learning starting to come out of that around confidence, around healthier eating habits, but also seeing differences in ASQ scores, which is the kind of stages and ages development scores for children who've received the small steps at home service for at least 18 months compared to those that haven't. So if you just move on to the next one, Mars. These are some of the other bits where we've commissioned learning and contributing to kind of evidence and research to sort of do that whole bit about informing local, but also influencing national. So we've got various other projects that we're currently evaluating and will continue to evaluate. So Stay One Step Ahead is a home safety project that the University of Nottingham delivered for us. And that is currently being analysed and progressed now, and that was around reducing hospital admissions for children through positive home safety messages. We've done a recent large-scale consultation with families across the city, with fathers, where we really focused on fathers in the early years. Often we focus on mothers, which I fully understand and appreciate why, but fathers and the role that they have in their child's early development, and understanding their experience of services and what could be better for them. And we had really strong messages come around from that around mental health and how they access information slightly differently to mothers. We also did some research around the effects of COVID-19 on families with children under 5 across the city. And we've also done various consultation with families. So it's a key part of the programme to really understand, and something that we're keen to work with partners as well, where possible, to really expand that understanding. So I think this is my last slide now, moving on to the next one. I've touched on that real importance, and certainly from the funder, from the lottery, to really contribute to making the case for early years and early intervention and prevention. So now the programme has been submitting evidence to various select committees, enquiries, etc. We often do that in partnership with the people I've spoke about, so City Care, Council, our family mentor providers, our other providers. And that's really to kind of keep going that bit around trying to influence at a national level changes in policy. So these are some of our recent submissions. And again, if anyone's interested in working on us around those, it has to have kind of an early years system change, early intervention spin, but it's something that we're very, very open to and will continue to do over the next few years as the programme enters its final phase. So I think that's everything. If you want to go to the last one, Mars, I think that's it. Yeah, and I'm pretty much on time, Hugh.
Thank you, Carla, and absolutely sort of 1 minute over, so well done, because you packed a heck of a lot of information, that 20 minutes, but really, really interesting sort of stuff, actually, and it's really interesting to hear, as I said, both the breadth of what you're doing, but the how you're doing, which is really sort of fascinating. A couple of questions from me, but you talked about the PCNs. Obviously PCNs are relatively new, they didn't exist when you first SSBC sort of started. You talked about a little bit of work with PCNs. What work are you doing with them, and do you think there are more opportunities to do more work with PCNs from your perspective?
I think there's huge opportunities for us to do more work with the PCNs, and I think the clinical directors, the directors for each PCN had just come into post just prior to COVID, and I was in the process of going out and meeting the relevant ones that kind of covered the wards within us. I think I managed to meet Jonathan, and we went into lockdown. So no, I think there's some real opportunities for us to kind of speak to those PCNs and say, what more would you like us to work with you on? Are there elements of our services which might fit really well in terms of some of that social prescribing model, that understanding of community, the engagement work that we're doing with PCN 6, Margaret Abbott's a core member leading on that, and she really wants to understand a bit more around why people don't take up offers of services that are there already. So we're supporting with trying to unpick and understand some of that, and the person that we've commissioned is very much embedded within the community as well. But lots of opportunities, really, I think, to focus on that place-based working.
Thanks, Carla. That's really helpful. And you mentioned that you obviously got the 4 wards you're sort of covering, and you mentioned that obviously sometimes you'll try one thing in one ward and sort of stuff. Are you finding a lot of difference between the wards and how you have to approach the issues? I mean, it's quite interesting from my head in the ICP in terms of uniformity or the sort of specificness of how you have to sort of approach different areas, even within the city. And I'm just wondering what your experience is. I mean, how transferable are some of these smaller projects, or do you find that they have to be very bespoke to the area?
We're getting a bit of a blend, actually, Hugh. So some are very transferable, and then it's more around what we're finding is what seems to matter for some communities is that it's about the provider being known, trusted, well respected within that area. And so, for example, where Framework are delivering our contract in Hyson Green and Arboretum, they very much then paired up with some of the smaller voluntary sector agencies that are working there, such as EPIC, and they've done work with the Renewal Trust. So a real sense of kind of place and people understanding and feeling affinity to the people that they already know and trust in their community. The language barrier, or the language, is something that we're exploring now. So we've recognised that obviously English isn't the first language for large proportions of our community, certainly in Hyson Green, Arboretum and St Anne's. And we're starting to look at how we've had to adapt some of what we've delivered in the messages. So we've recently done a review of the way that the family mentors deliver the handbook, and picked up from families that some of the metaphors that have been used and the way that the messages are received just don't land, you know, even if you try and translate them, they make no sense. So it's we're simplifying a lot of our messages to make sure that they do work better. But yeah, we are starting to now focus far more on a place-based approach as well.
Okay, that's really helpful. Another question, sort of, obviously you are just covering the 4 wards. Are there opportunities to take some of what you're doing wider? Are you doing that already, Carla, from that point of view? Allowing for the funding, I know there's a funding issue, but is some of it transferable anyway? And is it happening? Are there plans to do that? And where's that conversation at?
Yeah, some of the things such as the work we're doing around the Healthy Start voucher uptake and the Love Bump campaign, and we did another kind of public health campaign focused, the breastfeeding awareness, etc. They've gone citywide, and we are actually exploring the Healthy Start vouchers with Nottinghamshire County Council as well. So that could then potentially be, you know, city, county, potentially ICS footprint. I think it's a good question. It's one I push the lottery on always, Hugh. At some point in the next couple of years, we will be looking at the scalability of our projects, and I think one of the best ways of us testing that will be actually to try running the services in other areas in the city and looking at whether again it translates, and how do we start to scale up to get that full coverage and to understand the impact that then has. So yeah, some things are already going citywide, but it tends to be more those campaigns, the social media type activity, that kind of thing. There's 2 very specific, more targeted services that we've gone citywide with as well. One that's due to launch with the City Council quite soon around parent and infant mental health. And because it's a far more targeted service, we've had agreement from the lottery that we could run that as a citywide offer. And similarly with the Home Talk service, which is around children with delayed speech and language development at age 2. Right. There is an expectation that some of that will be just outside of our wards as well.
And final question, sort of sustainability long term. Obviously 45 million is a lot of money, brilliant, and you've done some fantastic co-produce work. What's sort of the thoughts on how we then sort of make what the learning is and what we achieve sustainable? Because that's going to be a challenge, I'm assuming.
It is going to be a challenge. It's the thing that's now starting to give me sleepless nights already. But no, you're quite right, and it's a really important thing. I think some of what we're doing, I think, is quite easily sustainable. It's about shifting practice. I'm saying easily, but it will need some time and work starting now. So it might be about changing practice. We're doing a lot of work on father inclusivity. A lot of that doesn't require any funding. It's just about getting workforce to think slightly differently, or contracts to be worded slightly differently. So there's some of what we do, I think, can become business as usual with the right level of support and with the right lead-in time. That means that it can be rolled out and used across the city. I think in terms and across a wider footprint, you know, ICP, ICS, I think in terms of some of what we're learning, the whole point of this was to test and learn, and then to help inform commissioners around what we take forward. There is no expectation for us to continue with everything that we've delivered, and we'll be starting to make decisions in the next 18 months around what we're going to stop, because it was a good thing to do. It's had some positive impact, but actually in terms of long-term sustainability, it's highly unlikely we'll be able to sustain that in the existing system. But the things where there's the most energy and the most promising results and the impact really being seen, that's where we'll need to start having those discussions, potentially with the ICP, certainly with the City Council, with the ICS, around how do we now start to think about using these models? What might we want to stop? What might we amend? And or what might we change moving forward? Other approaches, such as the parents, they're very clear that in the next 4 years, they want the programme to support building an infrastructure for them to just carry on after the programme's gone.
Right.
So that opportunity for the parent voice or community voice will be there after. That's part of our legacy. We're absolutely committed to that, and the infrastructure that we need to put in place now, so that can just become business as usual. But yeah, lots of different ways that we might need to approach it. Certainly we'll need a partnership response and some real creative thinking.
Right, lovely. Well, it's 1:30, and as I say, these are just vignettes, so we always try and finish them on time. So just for me to say thank you, Colin. That's been really interesting. Obviously, it will be sort of shared online. So if you have any colleagues who are interested in seeing Colin's very glamorous slides, actually, they're much posher than the slides I sort of do, but they're really great slides, Colin. They'll be available for people to see. Then the next share and session will be on the 11th of May. So thank you, everybody, and have a good afternoon.